So I have a question about the topic vaccine and prevention for the anti-zoster vaccine, because so it's possible for AL patients, because in France they're very keen on prevention, and some patients get valacyclovir a very long time. So could the vaccine just do a good job?
So yes, it's new, if I say. It's been studied for a couple of years. The idea was, is it safe in patients with weaker immune system? So it was studies with patients with multiple myeloma. That is not the same, but globally. Yes, it can be used. You just have to be careful that the vaccine it's against herpes zoster. It does not protect you against herpes simplex. It's another virus of the same family that gives, I don't know how to say in English, bouton de fièvre. So it's less severe, but the vaccine doesn't protect you against that. I think patients who don't have a big treatment, I think the vaccine is a good option, because the risk is not zero, but it's less important that under treatment with bortezomib, daratumumab, and the infection of herpes simplex is less severe. But I think for those patients, the vaccine will be proposed more and more, and yes, I proposed it in my patient. It's reimbursed since March in Belgium, so yes, I think it will be more and more proposed for the patient, because it's the way to have less medication.
Okay, thank you, but not to replace valacyclovir in the prevention strategy.
Yes, against herpes zoster, shingles, not simplex. So it's the discussion of the risk. I think you will not be protected against. So yeah, but I don't. Yes.
Okay, thank you. Thank you.
Hi. Also about vaccination. First, I wanted to to ask if it's normal that after stem cell transplant, all your childhood, not vaccination, but I had measles when I was a kid, and nobody ever told me that after stem cell transplant, you're not immune to measles anymore. Is that normal? Is that something they should have told me?
So after autologous stem cells, it's not, you don't lose all your vaccination that you had before. So you can lose some effects, but not all of them. It is very clear with patients we have to do on the allogenic stem cell transplant. But in autologous, you don't lose all your defense against this vaccine. So what the recommendation is less clear. What you should do is control the presence of the antibodies. We have a test that can say, do you still have enough antibodies? It's been used against hepatitis. That's why sometimes you know that you don't have enough antibodies. You have to do a repeat of the vaccine. So I think after stem cell, you should check if there is you are still enough protected, and if not, yes, do the repeat the vaccination. You don't. Everyone doesn't lose its antibodies after stem cell, but some yes. We know that we have to check after that.
Okay, so you know you have to check, because in my case they couldn't find any antibodies for measles anymore,
yes,
or for mumps. So there was nothing left.
It's very frequent even with age. It's recommended that healthcare people, as doctors, nurses, there is some recommendation that we repeat these vaccines. That we know that even with age, you can lose them, and especially after stem cell. Yes, you have to check. Do you still have antibodies against pneumococcus, against rubella, measles, and so on? And if not, repeat them.
I only found out by accident, but glad I found out.
A lot of people can use this protection just normally with time, but yes, we have to be aware of that.